Old-Fashioned Health. Good health from the inside and out. I'm Dr. Taz. I'm the host of your medical segment.
And I'm Chef Jay, host of the nutrition segment.
And I'm Jazz, host of the fitness segment.
We are super excited today about our episode because we have a very special guest with us today. Gerardo Lambert has flown from Connecticut to join us to talk about his health story and some of the struggles he's been through. And this story really touched, I think, all of us because it's such a story of really going against the odds, overcoming extreme difficulties, but finding your health again. And at Old-Fashioned Health, you know, that's exactly what we want for our viewers and for ourselves, is to really get healthy, whole, and be the best you can be. So Gerardo, tell us a little bit about your story. I think it started in 2005. So tell us a little bit about what happened to you and where you are now.
Well, 2005, I was diagnosed with cardiomyopathy. It's unknown how I had gotten it. They quoted it as idiopathic. It was a viral infection of some sort.
And you were completely healthy up until this point,
I thought I was, at least I thought I was. And so how I found out was I was having issues with shortness of breathing and fatiguing, and then I decided, let me just go into the ER and find out what might be happening. And that's when I got the bad news. They told me that my left ventricle of the heart was the size of a football, and that they had to try to admit me to reduce the size of it with medications.
So, you know, so many patients that come into my office will tell me the same thing. You know, they're walking through day to day and they are quote unquote healthy, and they have no idea that there might be anything brewing in them or anything going on. Did you have any warning signs leading up to this? Did you smoke?
No.
Did you have issues with stress? Did you have anything you think that might have given you a little bit of a clue that your heart was starting to fail? I mean, anything that would have given you an idea?
I was getting ready for a competition show. I was doing pretty well, and, you know, I wasn't taking any supplements. I was doing everything naturally. I was in the gym 5 days a week, and working out, exercising, and you know, cardio.
So totally out of the blue.
Totally out of the blue.
Wow. So this is 2005, diagnosed with idiopathic cardiomyopathy, which for our viewers, that means we don't have an explanation. It just kind of randomly shows up. But it affects the heart, one of our most vital organs and vital functioning parts of the body.
Right.
So you get the diagnosis, you start the process of trying to get better. Tell us a little bit about what that journey is like, because for a lot of people that have been healthy and then suddenly find themselves in a position to fight a particular illness, there's a lot that goes with that. Everything from the physical part of dealing with the illness to the emotional part of it. So tell us a little bit about, you know, maybe what happened next.
Well, I had a hard time accepting it. I had a hard time dealing with it, you know, because I was always healthy. I was always fit. I didn't think I would ever get sick, you know, like that, especially being, I had a strong heart, I thought at least I had. For the first 3 weeks, I was pretty depressed. I have lost my confidence. I didn't believe that I can make it, or I felt like quitting. I felt like not wanting to proceed with what I love doing. You know, I started to turn back on a lot of people. I was just shutting down.
You guys, I mean, we feel fortunate.
Very fortunate.
Yeah, we think we're going through something until we hear somebody else's story.
Yes.
And we're like, well, we're not going through anything until you overcome what you've overcome. It's amazing. So just to piggyback off of that, your passion for fitness, where did that start, and how did you keep that going after your diagnosis?
Well, I started when I was 16, you know. I was skinny as a rail, and I didn't want to look like that anymore, you know.
Fair enough.
Sort of wanted to be buffed and look, you know, like my coach. I admired him. He was such a superhero, sort of, you know.
Right, in mind, he was
like wow.
Yeah,
I want to be more like him. Right. And so I started working out, you know, looking at magazines, you know, like we would normally do. You think you get all the right information from the magazines. Apparently you did not.
No, you don't. Did that help you overcome what you're going through?
It really did. I'm a true believer. If you work out and you stay fit and you're healthy, your chances of like any sort of, you know, surgery, you'll come out pretty well.
You have a good base. You're already healthy.
Yeah, as long as you're eating healthy, you're at least working out, you know, and you know, you're in shape and you're healthy. That's what's more important.
And you know, I'm curious too, because so you were already in the fitness world and very conscious about fitness and looking good when you got the diagnosis.
Right.
Then you go through this period, from what I understand, you know, just talking to you, that you know, where you isolate, you kind of withdraw, you're almost engaging in things that hurt you to a certain extent.
Right.
What did it take in those months when you had the diagnosis and you're trying to really wrestle and grapple with what's happened to you?
Right.
What did it take to pull you out of that, get you back into the world of fitness, get you back into kind of believing that you can be healthy again? What was that? You know, I would love to know, because I'm always trying to instill that in my patients, and
Right.
even, you know, and I'm sure our viewers would like to know too. Kind of what triggered that for you?
Well, I had something to fight for. My wife at the time was pregnant.
Okay.
We were expecting a
Yeah.
boy, you know, a little baby boy, and I had such great support, my friends, my family, my clients, and that's what, you know, that's where I had the ignition to go ahead and ignite and fight and say, you know what, I can't give up. I have to fight it. Every night I would walk from 63rd Street.
You got this failing heart,
Yeah.
and you're still
I'm still fighting,
through, and
still
that's
fighting,
amazing,
yeah.
and working out.
Yeah.
So you push through. What was your lowest point, you think?
A couple of them.
I'm sure. I mean, I think every day was my lowest point, but I mean, out of kind of those first, and was that dark period just a couple months? Was it a year? Was it how long?
It was 5 years. You know, 5 years. Yeah, 5 years.
Okay.
Dealing with depression, dealing with I couldn't get back to work. Yeah, I was frail. I was fatigued. I was tired, passing out. And mind you, before the heart transplant, I had a pacemaker put in, a defibrillator implanted. I was having recurring heart attacks, falling all over the place. And just before the, you know, the heart transplant, I went into a coma for about 3 months.
And I read that about
yeah.
you, and I read that, you know, all these procedures were being done to sort of
Right.
save your heart, correct? You had the pacemaker, you had the defibrillator,
Right.
you had other procedures and surgeries done, and then
Right.
finally you get the heart transplant.
Exactly. Just dealing with the issues that I need to get back on my feet again, start working out, start feeling good about myself. And that was hard because any time that I felt that I pushed myself hard enough and I felt I was going to pass out, I was still reverting back to those feelings I was having, you know, prior before the heart transplant. So I was so scared to be alone. My independency, I didn't have that. I always needed my wife to be around me, walk me to the store, stay at home with me. I would think I was driving her crazy, to be honest.
So we know that your support group was critical, and it's something I talk to patients about all the time. You have to kind of shore up and really build that team for yourself.
Right.
Then your fitness was critical. Other factors you think may have factored into your success in terms of kind of going through this journey and
You
getting
think
better?
nutrition played a big part as well?
Nutrition's a huge part.
So what did you pretty much take as far as nutrition? Did you stick with what you took before you got diagnosed, or did you change it up a little bit?
I had to change everything.
Everything.
Yeah, after having a heart transplant, you know, there were certain things I couldn't eat anymore. I couldn't have sushi, which I love. I love sushi. It's my favorite, and so that had to stop because of the raw meat, and also, you know, it's just the causes of being affected by any sort of bacteria.
Right.
It can put me back in the hospital
Right.
and then, you know, recovering for a long period of time. So there were so many other things too. Sodium intake had to be very low. And being a heart transplant, you're put on blood pressure medications because of the nerve endings are cut off. It's not the same anymore.
Absolutely.
Yeah,
I mean,
so-
Jay, I mean, he's our esteemed nutrition expert here.
Right.
So we're going to pick his brain now a little bit, and you know, I'm sure he has questions about how you handled,
Right.
you know, the food component of
Right.
it, because it's something that really, you know, patients struggle with.
Right.
Like, what do I eat when I'm sick? What do I eat when I'm well? What do I eat for recovery? I mean, these are all things I feel
Right.
like people want to
So
know.
knowing that, you know, you had to stop eating, you know, raw meats such as sushi and different types of fish that come along with that, and lower your sodium intake, what became your derivative for basically your basic nutrition as far as proteins or vegetables? I mean, do you still eat fried chicken?
No,
more fried chicken.
no. In fact, I never did. I never did have
Right.
it. No,
Wow.
no, because I just in my family I was focusing on staying fit and looking good, and I didn't want to have anything that might deter my goal. So I focused more on steamed food, cooked, you know, fresh. You know, everything's nothing. As far as especially vegetables and whatnot, nothing was ever steamed. Had it raw, and so I was so keen on eating well. You know, and not consuming any alcohol and just drinking enough water.
So So mostly you would intake vegetables and fish and chicken,
Right.
It's baked or
Right, or cooked
or
or grilled, which was my favorite thing. I love grilling.
So you're a grill master?
I won't say I'm a grill master. I'm still working on it. So.
Okay.
Well, let's stop for just a second. We want to hear more from Gerardo and his amazing story of healing and hope when we come back from our short break. Thanks for watching Old Fashioned Health, good health from the inside and out. Welcome everyone back to our episode today of Old Fashioned Health, good health from the inside and out. Again, we are talking to Gerardo Lambert today, who has come in from Connecticut with this amazing story of hope and healing. He has had a heart transplant, but his journey through the diagnosis of idiopathic cardiomyopathy, which for everybody is just basically where we can't explain why your heart stops functioning, to being completely fit and looking fantastic today is really something I think all of us can learn from. So Chef Jay, tell me kind of, with the nutrition aspect, when someone's had a heart transplant or someone's been sick, kind of what's the best approach and what are some of your questions for this wonderful, amazing guy?
Some of my best opinion would be similar to what you were doing before you actually got diagnosed, eating clean, eating raw vegetables, getting your natural daily fibers from the raw vegetables and, keeping with your chicken and fish diet, that really helps you to stay healthy, such as what you were doing before. But one of my biggest questions is, did you know or have an idea of who had the heart before you and how has it changed even your diet or some of your daily habits? Because I've heard that once someone gets a transplant that they take on some of the characteristics of the person that actually had that implant before them.
Well, that's a good one. Interesting enough, I didn't know where the heart was coming from. The cardiologist did mention to me that it's a young heart. It's 20. You're coming from a 20-year-old who died in a motorcycle accident, and that's all I knew. And it was coming from Minnesota, and so that's all the information I actually had. And then from there on, once I received the heart, and that was it. Because I don't know the person. I had no idea who this person was like or what their habits were. So after having the heart, I felt I was still the same person. There was nothing that's changed. I'm still Gerardo. I'm still doing the things I love to do.
How long did it take you to get a heart, just out of curiosity?
It took me 3 weeks. From what I remember,
so it was quick.
It was pretty quick.
Is that lucky or is that standard? Or
I don't know if it's lucky or standard. I know that my blood type was A and B, so they called it universal.
Right, so a little
and
bit
so
easier
it was easier. I received a letter from my donor's sister, and was writing to me about who this young man was, and his name is Joshua.
So this is now a few years later,
right? This is 5 years now. 5 years later now,
okay.
And reading this letter, reading about who he was and how amazing this young man was, and the fact that I have a part of him in me, it makes I'm just so grateful that I'm here, and and I always carry him here. I'm always thinking, I can't let him down. I have to do all the right things, because this is a second chance of life, and it's been an amazing journey for me now. It's like everything I do now is all
purpose driven.
Yeah, it's just it means the world to me right now. It's
and
just,
thinking about him.
Yeah, always thinking about him. Always.
Oh,
Do you stay in contact with
chills.
him?
I get chills.
2 days ago, I had no idea I was friends with the mother of my donor. She found me because she looked up my first name. I was a trainer in New York City at the time, and associated all that, and then figured me out. I had no clue until day before yesterday. I put a post up on that I'm coming out to Atlanta and do the show. She connects a picture and she says, "This is Joshua on Facebook, and this is Jordan on the left." And I put the puzzle together, and I was so choked up because I didn't believe. Wait a second! After been talking to my donor's mom this whole entire time, I had no clue. So finally, I instant messaged her. Yeah, she knew.
Oh
Yeah.
my gosh. Journey, 5 years of being sick, now 5 years of having the heart and being relatively healthy.
Right.
What's next?
Oh, what's next? Just I'm getting ready for a show.
You on stage?
Yeah.
Starting your Yes, you should. Anytime you get a heart transplant, to keep that heart functioning and working well where your body won't reject it, you go on really strong medications.
Right.
And a lot of those medications will affect your kidneys, so you have to be really picky about what you eat, the supplements that you take, and probably even the type of workouts that you do, I'm assuming.
Well, yeah. I mean, for the first 6 months after the heart transplant, I wasn't able to lift anything heavy. 50 pounds was the most I can lift, and that was it for the 6 months straight. Today, I'm doing so much more with being cautious and warming up. I have to warm up 15 minutes before and cool down 15 minutes after, because my heart doesn't understand what's taking place, because the nerve endings are not anymore attached anymore. So what would take you maybe 5-10 minutes to warm up takes me a lot longer.
Right. That means you have to have pretty much a high protein diet to get some of that muscle building.
Right, and it's hard to maintain because I teach 6 classes a day. I do what's called Body Shock. I teach at the YMCA also. As you see on my shirt, it's Door-to-Door Fitness. It's a company I run. It's from in-home services that I provide, which is yoga and nutrition as well. But Body Shock is where I teach at the YMCA in Westport, Connecticut. And
So your show's coming up in November.
I'm hoping that everything
Is
goes
this the
well.
first show after your heart transplant?
My first show after my heart
Wow.
transplant.
So
yeah.
that's exciting.
Yeah.
Please let us know when it is.
I will.
Yes,
I will.
and for
That would be
our
definitely.
viewers and people watching today, where can they follow you? Where can they find out more information about what you're up to, learn more about your story?
Well, you can follow me on ddfitnesstraining.com. That's double D's, training, training.com. You can get all the information you need about me there. So.
Fantastic. Well, thanks for being here
Thank
with
you
us.
so much.
Really
Thank you.
appreciate it.
I really appreciate it.
And thanks for watching today, guys. We really feel like this is a special episode of OldFashion Health, and health from the inside and out. We'll see you next time.